Asthma is really a disease of inflammation of the airways. That's really the main component of asthma. There's a second component that we call bronchospasm, and it's really those two elements, the inflammation and bronchospasm, that manifest themselves as asthma. For the person who's experiencing an asthma attack or even asthma symptoms, these are really very uncomfortable. The shortness of breath or the feeling of not being able to catch your breath and not knowing when that will go away is very frightful, both to the patient and to the patient's family or loved ones. What we have here is a normal airway in the lung and an asthmatic airway. So you'll notice the normal airway is nice and open, and you can see a nice opening here, so air flows out in and out very easily. Well, in the asthmatic airway, you'll see that the airway looks swollen. There's mucus filling the airway, and this is really the basic problem with asthma, is this inflammation that's there on a daily basis. If the airways are narrowed, it's actually harder to get air out than it is to get air in. One of the tests that we do on patients who are having asthma attacks is to get a chest x-ray. So what you see is this hyperinflation or air trapping on the x-ray. Asthma in children has become a very significant problem really over the past 30 years. The incidence and prevalence has gone up quite dramatically, where now it affects nearly 1 in 10 children in the United States. We're not really sure why the incidence of asthma has increased over the past 30 years. Some people have suspected changes in the environment may be a consideration, obesity, and more recently Tylenol, or acetaminophen rather, has been a consideration for the increase in asthma. One reason people have started to consider acetaminophen as a possible cause for the increase in asthma is that people have observed that in areas where there's higher acetaminophen use, that asthma is more common. In children who have used more acetaminophen, they're more likely to have symptoms. So this has led many people to wonder if acetaminophen is not the cause for the increase in asthma. It affects an antioxidant called glutathione. And so we know in kids who are having asthma attacks that they have lower levels of glutathione. We also know that acetaminophen can lower glutathione levels. So it may be that if acetaminophen is lowering glutathione levels, it's either causing or worsening asthma. In terms of advice to parents, it's still premature to say that acetaminophen is either causing or worsening asthma. Certainly there's some evidence out there that suggests it, but there are more studies that are needed. So at this time, parents don't need to be alarmed or worried about using Tylenol in their children. Certainly there are other options out there. Ibuprofen is one option that parents can provide their children to provide comfort to them or to lower their fever. In terms of what parents may expect when their child has been diagnosed with asthma, there are a number of children who outgrow asthma. So particularly in the children who've been diagnosed as preschool age children or toddlers, about 2/3 of those children will stop having symptoms by the time they're in kindergarten. I had asthma as a child, so to be able to correctly identify, diagnose, and successfully treat a child is actually very satisfying. Ideally, people with asthma should be seen at least a couple of times each year by their healthcare provider to make sure that their asthma is under control.